great facility here. Angela, Rick, thank you very much for acting as our moderators. And, when Rick said we were worried about the microphones being dropped or broken, he left out being thrown also. We want to make sure that but really, you know, one of the things that I worked really hard on was the fact that we worked hard to make sure that this bill didn't come to a vote before August, and I made it extremely clear to the leadership in Congress that if this thing came to a vote before I had a chance to come home in August, that they could not count on my support. It didn't matter what the bill said. For me, it was more a procedural thing to have an opportunity to do exactly what we are doing here today. And I want to say that I have not taken a position on the bill because, frankly, there are a number of things in the bill that I like and a number of things in the bill that I don't like. I didn't write the bill, and I'm not here to defend the bill. I'm here to talk about health care. So primarily, what I would like to hear more than anything else is your views on what you think is good, what you think is bad, what you think should be improved, should not be touched. And I'm looking forward to a really good discussion in terms of what we think needs to be done and what we think we can do to make it better. So I appreciate again all of you for being here, and let's get started.
We are going to follow some rules. Please sit down. Is anyone else interested in having some good dialogue with the Congressman? Yes, ma'am. Wait for the mic, please. I'm not going to throw that. Okay, hi, my name, is that right?
That's right.
My name is Cynthia, and I really have a couple comments. I really would like to hear what this young gentleman said, but I couldn't catch it, so maybe if you could, well, I want to. And I think that
we're very interested in what you have to say.
What I have to say is that it's so wonderful that so many people came out here today, and I think that with the different opinions, I think that nothing is ever accomplished by violence, whether physical or voice violence.
Oh, I want to thank you for coming to this. Oh, I'm sorry. I'm Jeff Speck. I live in Arcuri. I want to thank you for coming to this forum because I think this is extremely important that we can share our views about this very important thing. We're going to try and transform approximately a fifth of the private companies in this country and put it under government control as far as I can see in this bill. This bill is extremely complicated. I don't see how you guys can even go through it in a year, let alone in a couple of months. And when I got copies of it and I started to read it, and I must admit, I was totally flummoxed. I had to be a lawyer to really get through it. Some of the things that really bother me about this bill are that it makes a commissioner who's in charge of our health care, and this commissioner is above the judicial review. He or she can deny or allow anything, and there's no review of this. Also, the thing that bothers me, because I'm really a dentist and I'm a small business, we have to pay, well, we don't have to pay. Right now, a lot of us pay our health insurance for our employees. It's very expensive. Some of us don't pay at all. I pay most of it. But the trouble is that if you make a single payer plan or give us an option for that, what will happen is the small businesses, due to cost, we will have to go to that plan. And so basically the small insurance, or the insurance companies will lose their number one consumer, which is us. Small businesses, they employ more people in the United States than all the big businesses put together. So I think that before, when you look at a plan like this, you have to see how it affects us, the taxpayers, and the small business employers, because the small businesses really are the backbone of this country. And if you push us down, we'll just hire less employees.
Yeah. Thank you, Doctor. I think that sorry, where are you from?
My name is Carol from North Bay, New
Thank you.
York. I am a small business owner. I am on Medicare. I would gladly give up my Medicare and pay for my own insurance completely if this government would go back to the constitutional rights, the policies, the amendments. The government has gotten so large from so many people. For many years, people took care of themselves. Their families took care of them. Their community took care of them. And at no time was it the federal government's job to enter into the daily life of citizens. I would like you to consider, when you're considering this health insurance bill, I would like you to consider all of the people of the country who want to be Americans. They do not want to be one world order. We want to be
I'm Jenny from New Hartford, and it's an old head lawyer. First of all, thank you, Congressman, for coming.
Thank you for being
Appreciate
here.
it. The Health Care Reform Bill will establish a committee headed by the pro-abortion Surgeon General to decide if abortion will continue to be funded by taxpayers. In July, during the month of July, about 8 amendments were introduced to discontinue taxpayer funding of abortion. They were all defeated. Since over half the population now is pro-life, Congressman, how will you vote when this pro-life issue is introduced again?
One of the things that the present bill, the draft that they have now, and again, this is a draft. This isn't going to be, I think, ultimately what ends up. But this bill, and I'm convinced that any bill that comes forward, will contain what's called the Hyde Amendment. And the Hyde Amendment, and this bill contains it as well. The Hyde Amendment says that the federal government, that no federal funds can be used to fund abortions. That is in this present bill, and I expect that to continue and go forward in it. So the bill that is proposed right now, not the Senate bill, the bill out of the House of Representatives, which is the only one that I have seen, contains the Hyde Amendment, which says that the funding, that the federal funding cannot be used. Just the way it cannot be used now, it can't be used in the future. But it's not. But they have not done that, so it still continues to be in the bill, and I support that.